It is with great and utmost pleasure that I welcome you to the 10th edition of the Intergenerational Dialogue 2024, hosted here in Kasese, organized in partnership with our dear partners, Save the Children in Uganda.
As we gather to reflect on the power of intergenerational and religious conversations, I would like to highlight a crucial issue affecting our communities, particularly the challenges faced by the girl child and adolescent mothers.
Uganda still grapples with a lot of teenage pregnancies, mental health challenges, unemployment, drug and substance abuse, and so many other challenges that do not allow young people to fully achieve their full potential and live towards achieving general wellness.
According to the Uganda Demographic Health Survey, UDHS 2022 results, about 24% of women aged 15 to 19 years had initiated childbearing by the time of the survey, with 18.4% having had live birth, while 5.1% had initiated childbearing by the time of the survey.
UNESCO has reported that quite a number of young people in Uganda, about 1.8 million, joined primary 1, but not more than 400 finished primary 7. The question is, where is the 1.2 million children that do not complete P7?
Child marriage remains common, with 34% of girls married before the age of 18 and 7% married before the age of 15.
These high teenage pregnancies are attributed to some factors where we got issues like poverty levels.
We are talking about poverty as one of the biggest drivers of teenage pregnancy. But government has put up, programs. How are our parents tapping into that? How are our young boys, our young girls tapping into that?
These sexual and reproductive health challenges are closely linked to gender inequality, which continues to hinder progress towards gender equality and Uganda's broader human rights and development goals, including the 2030 agenda.
We have only one big problem as religious leaders. Talking about sexuality is a taboo to some of the religious leaders.
This does not mean that by sexuality education we mean teaching young people how to do sex. It means empowering young people with skills, knowledge, and capacity to make decisions, have self-control, and know the different options and alternatives available for them.
So as parents, as leaders, as boys, as men, as women, we should see how we come up with talking to our young people. They need that information. We are all adolescents, and we are all transitioning from being a child to adulthood. Let us take this opportunity that we have here today for this dialogue to renew our pledge to advocate and protect for the health rights of these young people.
There is need for establishing multi-sectoral mechanisms to coordinate planning, financing, implementation, and scaling up of adolescent sexual reproductive responsive services at national and decentralized levels.
We need everyone. For example, we need the government, that is the members of parliament and other government institutions like the police, the judiciary, the ministry, and any other.
Currently, the issue of police, the examination, under the government policy, all our facilities, all clinical officers, medical doctors in the government, we don't charge for medical examination.
Don't be used just because of money. Even if I'm poor, no one is going to use me just because of money.
So we implore the community members to sensitize the people and specifically the DHO to leverage to ensure that these services are close to the people and they do not actually affect us.
the take home should be that out of this, we need to come up with, for example, a petition that we can now take on to a higher level of discussion so that we have lasting solutions that are encompassing all the other challenges and respond to them. Probably we will save a soul and see ourselves move forward.
Let us use the power of this dialogue to work together across generational and religious lines to ensure a brighter and inclusive future for every child, every mother, and every family in Kasese district and beyond.